if somebody slips, if somebody falls down, or if somebody bends their knee accidentally more than 90 degree, which is not recommended, then the ligament can become loose. Why the ligament get loose? Why your ACL ligament get loose after the surgery? Friends, many of you send us a query that I got the surgery 2 months back, 2 years back, 4 years back, and now I am feeling the same symptoms which was before the surgery, which is instability. So friends, as we all know, ACL surgery is done by arthroscopic method, and a surgeon will make your own ACL with your own hamstring tendon. The hamstring tendon is a human tissue which has an inherent property of stretchability. During the surgery, we often try to pre-stretch the ligament at its highest level so that it doesn't stretch later on. And in the conventional screw surgery, we fix the ligament to your upper bone femur with a endo button or a tightrope RT or a flexible loops, and to the lower bone tibia with an screw, either a bio screw or biocomposite or a titanium screw. And then you have to follow a very strict protocol, very strict and disciplined protocol after the surgery, in which you have to bend your knees up to only 30 degree for 1 week, then 40 degree for the second week, and so on. And the complete bending will come after 2.5 months. So in this very strict long rehabilitation period, if somebody slips, if somebody falls down, or if somebody bends their knee accidentally more than 90 degree, which is not recommended, then the ligament can become loose. Secondly, because it's an stretchable tissue, no matter how pre-stretch we do during the ligament surgery, sometimes it stretches by its own. So this is a failure of the conventional screw surgery, in which there is a high chance that the ligament will get stretched out after the surgery. To prevent all of these complications, I prefer to do all inside ACL reconstruction with Fibertape internal brace. When we make a Fibertape internal brace across your ligament, it acts as a seat belt, acts as the insurance of your new ligament. It prevents the ligament from getting stretched, from getting torn, from getting loose, and it ensures that you have very quick recovery. Like from the first day, you can bend your knees up to 90 degree. You can walk without support. Within a month, you will be bending your knee completely. You will start jogging within a month, and within 3 months, you will be back to sports. And the failure rate of this surgery is negligible because the Fibertape internal brace will prevent it from further loosening, further stretching, further damage. So friends, if you feel that your MRI is showing ACL tear, or if you feel that your knee is not stable, then you can send us your queries on WhatsApp and we will be very helpful to help you out. We care about you.